Uh-oh, there's an active tuberculosis case caused by Mycobacterium tuberculosis. Don't worry though, I'll give you some options about how to contain and eliminate this infection. So first of the containment options is an isolation order for about 2 weeks or 3 weeks so as not to spread it to the public. Second, we have follow cough and hand hygiene, such as washing hands frequently and for the appropriate amount of time and always coughing or sneezing into your elbow. Third, we have allow constant fresh air flow into your home. So open a window so as air does not get concentrated with bacterium. Fourth, we have quarantine family members of the infected person, because may have been exposed. Fifth, we have isolate the family as much as possible from the infected person to prevent giving it to that family. Sixth, we have wear a mask. It is always best to wear a mask so you can prevent you and your family from possibly spreading tuberculosis. Seventh, we have investigate where the pathogen could have come from to possibly further contain the infection. And fourth, we have test the family and others that have interacted with the infected person and follow the containment rules for any positive tests. As for elimination, here are the options. First, use a multi-drug antibiotic treatment. This will be used for a long time to completely get rid of the body infection, and it will use multiple drugs so as to deal with that infection. Second, use an advanced drug treatment for any antibiotic-resistant strains of tuberculosis, so it would be treated with more drugs and for a longer period of time. Third, we have test and treat relatives if needed, and treat those relatives if they have tested positive. Fourth, we have post-exposure prophylaxis, and that would be for any positively tested individuals. They should be treated with antibiotics to prevent any symptoms, if there aren't any, so as to stop the infection from fully manifesting. Fifth, we have surgical treatment. This is not used anymore because the multi-drug treatment is so effective. And sixth, we have supportive care. This would be for any severe cases that involve hospitalization. Seventh, we have a broad spectrum antibiotic. This would not be useful because tuberculosis must be dealt with specifically to avoid further damage to the body. If all of these containment and elimination policies or options are followed correctly and the best ones are used, then there's a very high chance that the spread of infection will be minimized and that the infection will be eliminated from that person's body.